morning, everyone. Thank you so much for the opportunity to share our journey. What I would like to say is that what we do isn't perfect at all. We are still on the journey. We're still on the process of doing things. We make mistakes, but we try also, of course, work with Liam and the others to correct it. And just a caveat that our experience might not actually fully resonate with yours because we have certain facilities which other trusts wouldn't have. So let's get to that. Just like what Liam had said, every NHS trust actually needs to reach net zero by 2040 on the direct emissions, and then 2045 for the indirect emissions. And for RWT, we did say that we're gonna reach 25% in 2025. If you ask me whether that's actually a science-based target, I would tell you no. We thought 25% in 25 sound good. So it was just, yeah, that's a good slogan. But actually, come to think of that, we're on our way to achieving it. So that's one good thing. So what contributes to our carbon footprint? I think everyone is actually, familiar with that now. Since 2020, we've been seeing this. But what's important is the one that I have put, like, you know how it is in contracts? They have this fine print. That's the fine print for us. So we did a baseline survey, and we did a carbon footprinting exercise. And it was painful, but it was worth it. So we've established that the baseline in 2020-21, the trust carbon footprint was 63,823 tons of CO2. So since we are actually talking about waste today, I just wanted to show you what we actually have in terms of facilities. So what we have is we have an in-house team. So we don't contract out our waste management. It's an in-house team which actually composed of 24 staff. And then there's a professional waste manager, so a fully trained professional waste manager that actually leads that. And of course, we do have qualified staff in terms of collect and transfer waste, and also 50% has an NVQ2 waste management qualification. And we're working into making sure that they all achieve that. And we also have an incinerator on site. We're one of how many now, Liam? 4. So we're one of 4, and I think our incinerator is about 2 years old, just over 2 years old, so it's a bit young. And when you actually sneeze across it goes, ah! So it doesn't like things that makes it less environment friendly. So we have a waste yard. Our waste yard is actually quite substantial. And also we have compactors, bin wash on site, which the incinerator provides the hot water for. We got cardboard balers, we got motor oil tank, vegetable oil tank, we compound, chemical safe, garden waste skip. If I actually list all of them, there's more to that. Same way that we have, of course, the walking aids area as well, section where we've got all the walking aids as well under a canopy. So what's the waste management services? What services do we provide? We do our in-house training. So we've got a team that does the training. We got clinical waste disposal and collection service, so RWT and Walsall and the community sites that we have as well. Like what I said, we have an incinerator on site. We have an in-house confidential waste recycling. So an in-house one because we found that it's better for the environment, better for our pocket. And of course, we've got recycling. So we recycle plastic, food, furniture, DMR, hard plastic, batteries, tires, motor oil, vegetable, bulky waste, wood, rubble, all sorts of things we recycle. Reuse scheme as well, so we have walking aids reuse scheme. We have also, which I didn't put in here, we actually have an in-house furniture and equipment reuse scheme as well. And then we also do waste bin, so we upcycle them and we reuse them. So upcycling is that if we have a bin with faulty wheel, we actually replace it with a new one or scavenge one, and then it goes on again. So that's the other one. And also textile, we repurpose them into rags. So anything like uniforms and other things, because unfortunately, uniforms are not accepted outside the private recycling, don't accept them because they come from a hospital. So what we do is we repurpose them and they became rags, which we actually use in the incinerator as well to clean up. So cardboard recycling we do. We have also the in-house waste audit, inhaler reuse scheme, and also we have and chemical recycling, and we have bin decontamination. So there's more to that. How did we do it? Key is that we have experience and qualified waste professionally. That is key. Because for me, for us, as head of sustainability, I will go to him with an idea. He can tell me, actually, that's rubbish. We will not comply with regs and all those things. He will tell me, but at the same time, he said, if we do it this way, we'll be better off and it will work. So we would not go into, so there is that, because there is that knowledge and experience on ways, he knows then what can be done so that we don't fall foul of standards and all that stuff. And at the same time, still implement the changes. Risk assessment of waste operation, that's the first thing that is done. Risk assess basically the whole waste operation and say, this doesn't work, we need to put this in place. And that's quite important. And then we built a qualified trained team. They also reduced the risk of non-compliance to regs, reviewed all the contracts for value for money and service effectiveness. Hence, like what I said earlier, we've got our confidential waste in-house because we found that it's easier, better for the environment, and we did save money. And then we identified local suppliers. We have recycling, let's say our hard plastic is recycled by a company, actually about 10 minutes away from the hospital. And also centralized waste collection service. So we have a waste collection team that goes around and then they pick up certain things along the way to make sure that logistics carbon is kept low. And then implemented in-house recycling services, like what I said. And then we implemented, of course, the in-house training and waste audit process. There are more to that. So I just wanted to emphasize this because one of the key things that actually we do is, of course, the reuse, upcycle, and recycling of things. So what is basically just there is a desk, which we reuse as part of the furniture recycling scheme. And another one we do, last year, we actually saved £15,238 by reusing our furniture. That's just a furniture. The year before that, it was 28,000. So which means then that every time, it might not be the same every year, but there's always a savings. And the reason why also it's lower savings this time is that because we had to basically rent a space to put the storage in, and that, but then it paid itself. In terms of the production of waste, we actually produced 3,328 tons of waste in 23-24. Previous to that, it's much lower. The reason for it is that we've expanded our services. And then our clinical activities as well has expanded. And that's one of the things that, you know, sometimes we wanted to maintain, but when there are spikes of services, that actually then, but you have to keep track of that. But we actually did manage to actually divert totally, because we have achieved zero landfill. 1,415 tons has been out of landfill. We did have landfill the year before. We reported as landfill because the provider that took them couldn't tell us exactly that they have actually put in energy for waste or whatever it is. And because they couldn't give us the answer, we said, well, declare it as landfill, because we cannot evidence that it didn't go to landfill. So what was the benefits delivered? We did achieve 39% recycling rate all across the trust. Energy generation and security. Our incinerator produced 2 megawatts of energy for the trust. And it's actually part of the whole energy security strategy for the trust. So the incinerators included in that one. We did achieve zero landfill. Cost savings for the incinerator actually saved £250,000 for energy cost. And also, the whole of the waste management service saved 92K last year. And of course, there's carbon emissions reduction, although myself and Liam were looking at each other with the beady eyes about certain aspects of it. And then, of course, full compliance with the waste regs, and then making inroads on the 2020-60. And then, of course, the corporate social responsibility benefits as well, because with our inhaler recycling and our waste recycling, our walking aid recycling, those what we call our team doesn't want, they get sent actually to developing countries, which basically affords people who could not have afforded any walking aid to have one. So that's like use or tosses and things like that goes over there. So what are our next steps? We're increasing, very ambitious, increasing recycling to 51% to achieve recycling center status. And then achieve the 2020-60 ratio on clinical waste. We're launching what we call recycling bug promotion animation. I'm not so sure about recycling bug, but that's the name of it at the moment. But we're doing an animation to promote it. And then collaboration with Wolverhampton City Council to promote our inhaler recycling. And of course, reduction of the food waste at world level. Because at the moment, when we learned that there's some changes that's gonna happen with the way food waste is disposed, which used to be much stricter down the disposal, we've already implemented the recycling scheme in the trust. So there's now a company that takes them away. But what we're targeting now is actually the reduction of the food waste at the world level, because they're a bit higher than acceptable. And that's it. Thank you so much.